Hi, it's James Splain. I'm here in Kenai. Beautiful Kenai, beautiful day, nice and sunny. We were out walking around earlier after lunch. And basically we're moving along in our cancer bundle, and this is kind of like colonoscopies and the colorectal screening and the PAPs. There's a couple different ways that we can enter it. A lot of the smaller clinics are going to be doing case management, so these might actually be historicals that they'll be entering as they're doing their case management work. Here we go to selected measures, and that's version 13, and this is where we kind of get the logic. It might shift for next year, but for last year, basically it was looking for your active clinical female patients age 52 to 64 and to see if they've had a mammo done recently within the last 2 years. So there has been a change in this. I think it used to be 3 years and now it's 2, so it's getting a little bit more aggressive and this number is a little bit harder to make. So what we're going to do is we're going to go in and look in a couple of places in the EHR how you could satisfy that measure. First, if you're wicked cool and you have that on site, you can just basically type it in as a CPT code, find it, and put it in there. Or you can look it up as the actual code itself if you know it, and put it in there. Radiology, search, there it is. Okay, and that would actually satisfy the measure. Another place that you could do it is set it up as a superbill item, and superbill pick lists and stuff are basically managed right here with the clinical applications coordinator. So you could go in and you can add and actually create superbills. So if you're a provider out in the field and you kind of have a bunch of codes that you use over and over again, get with your clinical applications coordinator and they can help you set this up. Add a pick list and add the CPT codes that you use most often in that pick list. And they can even choose who sees it, so you can show all or just you and whatnot. So that kind of makes it nice and slick. Now if you're a case manager and you're going through and you're basically following up on the referrals that went out or consults that went out and whatnot, you're going to close that out here. So what we're going to do is we're going to go to add, and this is going to be an historical, and you can see there's the PAPs and there's historical HIVs and colonoscopies, and you can basically enter it here, pick your date, happened 2 weeks ago, and you can just say where it happened. Say Prov. And that would enter that historically down here. All those will satisfy that measure. But one of the things that I really want you guys, a lot of people don't know about this, is that list that we pulled up here is actually GPRA services. It's a pick list that is managed. And you can manage that in here. Let's go up here, and we kind of see all the different lists. You can actually add different codes to here, right there by hitting add. So if there are other historical events that you guys are doing and you'd like to add, feel free to do it right there. I hope this helps and you guys meet your measures, and good luck. Thanks.